Fluticasone nasal spray is used to relieve sneezing, runny, stuffy, or itchy nose and itchy, watery eyes caused by hay fever or other allergies, caused by an allergy to pollen, mold, dust, or pets. Fluticasone nasal spray should not be used to treat symptoms, for example, sneezing, stuffy, runny, itchy nose, caused by the common cold. Fluticasone is in a class of medications called corticosteroids. It works by blocking the release of certain natural substances that cause allergy symptoms. Fluticasone comes as a prescription and non-prescription liquid to spray in the nose. Fluticasone nasal spray is usually sprayed in each nostril once daily. Alternatively, fluticasone nasal spray is sometimes sprayed in each nostril twice daily, in the morning and evening, at a lower dose as recommended by your doctor. If you are an adult, you will begin your treatment with a higher dose of fluticasone nasal spray and then decrease your dose when your symptoms improve. If you are giving fluticasone nasal spray to a child, you will begin treatment with a lower dose of the medication and increase the dose if the child's symptoms do not improve. Decrease the dose when the child's symptoms improve. Follow the directions on your prescription or product label carefully, and ask your doctor or pharmacist to explain any part you do not understand. Use fluticasone exactly as directed. Do not use more or less of it or use it more often than directed on the package label or prescribed by your doctor. An adult should help children younger than 12 years old to use fluticasone nasal spray. Children younger than 4 years of age should not use this medication. Fluticasone nasal spray is only for use in the nose. Do not swallow the nasal spray and be careful not to spray it into your eyes or mouth. Each bottle of fluticasone nasal spray should only be used by one person. Do not share fluticasone nasal spray because this may spread germs. Fluticasone nasal spray controls the symptoms of hay fever or allergies but does not cure these conditions. Your symptoms will probably not begin to improve for at least 12 hours after you first use fluticasone, but it may take several days or longer before you feel the full benefit of fluticasone. Fluticasone works best when used regularly. Use fluticasone on a regular schedule unless your doctor has told you to use it as needed. Call your doctor if your symptoms get worse or do not improve after you use non-prescription fluticasone nasal spray daily for 1 week. Fluticasone nasal spray is designed to provide a certain number of sprays. After the marked number of sprays has been used, the remaining sprays in the bottle might not contain the correct amount of medication. You should keep track of the number of sprays you have used and throw away the bottle after you have used the marked number of sprays even if it still contains some liquid. To use the nasal spray, follow these steps. Shake the bottle gently before each use. Remove the dust cover. If you are using the pump for the first time, have not used it for a week or more, or have just cleaned the nozzle, you must prime it by following steps 4 to 5 below. If you have used the pump in the past week, skip to step 6. Hold the pump with the applicator between your forefinger and middle finger and the bottom of the bottle resting on your thumb. Point the applicator away from your face. If you are using the pump for the first time, press down and release the pump 6 times. If you have used the pump before, but not within the past week, press down and release the pump until you see a fine spray. Blow your nose until your nostrils are clear. Hold one nostril closed with your finger. Tilt your head slightly forward and carefully put the nasal applicator tip into your other nostril. Be sure to keep the bottle upright. Hold the pump with the applicator between your forefinger and middle finger and the bottom resting on your thumb. Begin to breathe in through your nose. While you are breathing in, use your forefinger and middle finger to press firmly down on the applicator and release a spray. Breathe gently in through the nostril and breathe out through your mouth. If your doctor told you to use 2 sprays in that nostril, repeat steps 6 to 12. Repeat steps 6 to 11 in the other nostril. Wipe the applicator with a clean tissue and cover it with the dust cover.